In this podcast episode, Dhru Purohit and his guest Max Lugavere delve into the pressing issue of Alzheimer's disease and cognitive decline, discussing the alarming statistics surrounding these conditions and the critical role of diet and lifestyle in prevention. With 55 million people worldwide diagnosed with Alzheimer's and dementia, and projections indicating that this number could triple by 2050, the conversation emphasizes the urgency of understanding how our daily choices can influence long-term brain health. Lugavere begins by highlighting that Alzheimer's disease is not an overnight condition. Rather, it is a disease process that simmers for decades before symptoms manifest. He stresses the importance of nutrition, asserting that the foods we consume today can pave the way for cognitive health or disease in the future. He adopts an omnivorous approach to diet, advocating for a balance of both plant and animal foods, which offer overlapping and distinct benefits. A significant focus of the discussion is on the dangers of ultra-processed foods, which constitute a staggering 73% of items in the average supermarket. Lugavere cites a study indicating that for every 10% increase in ultra-processed food consumption, there is a 25% increase in the relative risk of developing Alzheimer's disease. He urges listeners to prioritize whole foods, as even small improvements in dietary choices can lead to long-term health benefits. Lugavere emphasizes the importance of incorporating omega-3 rich foods, particularly fatty fish like salmon, mackerel, and sardines, into the diet. These foods are crucial for brain health due to their high content of omega-3 fatty acids, which are essential structural components of the brain. He also advocates for the inclusion of grass-fed beef and eggs, the latter being a top source of choline, a nutrient vital for neurotransmitter function and memory. In contrast, Lugavere warns against the consumption of ultra-processed foods, which are often high in added sugars and unhealthy oils. He explains that these foods are engineered to be hyperpalatable, making it difficult for individuals to moderate their intake. Instead, he encourages listeners to focus on whole foods, such as dark leafy greens, berries, and avocados, which are nutrient-dense and beneficial for brain health. The conversation shifts to the importance of physical activity in maintaining cognitive health. Lugavere notes that while long-term data on exercise and brain health is still evolving, it is clear that regular physical activity can help prevent conditions like insulin resistance and hypertension, both of which are risk factors for dementia. He emphasizes the value of resistance training, which has been shown to improve metabolic health and reduce the risk of cognitive decline. Lugavere also discusses the significance of social connections and mental engagement in promoting brain health. He highlights that social isolation can be a risk factor for dementia and encourages listeners to stay socially active and engaged in lifelong learning. This can include pursuing hobbies, learning new skills, or even taking up a musical instrument. Purohit and Lugavere explore the challenges faced by families dealing with cognitive decline, particularly the lack of emphasis on nutrition and lifestyle changes in traditional medical settings. Lugavere shares his personal experience with his mother's diagnosis, noting that many doctors are undertrained in nutrition and often overlook the impact of diet on brain health. He emphasizes the need for patients and families to advocate for themselves and seek out information on how to improve their health through dietary and lifestyle changes. The discussion also touches on the influence of environmental factors on cognitive health. Lugavere highlights the importance of clean air and water, noting that air pollution has been identified as a risk factor for dementia. He encourages listeners to be mindful of their surroundings and consider air quality in their homes, suggesting the use of air purifiers and regular maintenance of HVAC systems. Lugavere concludes the conversation by emphasizing the need for awareness and education regarding cognitive health. He believes that understanding the modifiable risk factors for dementia can empower individuals to take control of their health. He encourages listeners to be proactive in their dietary choices, physical activity, and overall lifestyle, as these factors can significantly influence their cognitive destiny. Throughout the podcast, Lugavere shares insights from his documentary, Little Empty Boxes, which chronicles his journey with his mother as she navigated her diagnosis of dementia. The film aims to raise awareness about the potential preventability of dementia and the importance of lifestyle choices. Lugavere hopes that viewers will feel less afraid and less alone in their struggles, while also gaining valuable information about how to improve their cognitive health.